Going on, everybody? So today I wanted to talk a little bit about inversion tables. It's actually, I get asked about this all the time by my patients. Should I be using an inversion table? Should I get an inversion table? Is it a waste of money? And in case you're not quite sure what an inversion table is, it's one of those tables where you hook your feet in and then the table pivots and you basically hang upside down. And the idea is that it's supposed to traction out your spine, take pressure off of the joints, take pressure off of the disc, take pressure off of the nerve. So is it helpful? Is it something that you should do, that you should look into? Well, first let me just say that the concept of spinal traction, spinal decompression is actually very beneficial. Whether you're a chiropractor, a physical therapist, a physiotherapist, a spinal orthopedist, spinal traction and spinal decompression is an extremely common and very successful treatment that's given to people who have a lot of compression type injuries or issues in their low back. So it might be a bulging disc or a herniated disc, maybe like a facet syndrome, degenerative disc disease, osteoarthritis. It can be very beneficial, creating space, taking pressure off of the spine. So the idea of spinal decompression, of spinal traction, is actually very solid, and we see very good results with it. Now, specifically about the inversion tables, this is generally what I tell my patients. It can be beneficial, but the biggest issue of it is hanging upside down. And what I mean by that is, so like I said, these tables flip you upside down, and to really get a good benefit of spinal traction, to really get a good stretch, really decompress the spine, you really need to be in traction for anywhere from 15, 20, 25 minutes at once. That's a really long time to hang upside down. Most people can't tolerate hanging upside down for that long, and that seems to be one of the biggest limiting factor, the biggest issue with inversion tables, is hanging upside down for that long. So I will say this: if you can hang upside down that long and it doesn't bother you, it doesn't make you pass out, it doesn't make you dizzy, it doesn't give you headaches, then yeah, it's probably pretty beneficial for you. And if it makes you feel better, I would say go ahead and do it. The complaint that I hear all the time from patients is that they bought an inversion table and they used it once or twice, but it made them dizzy. I've had patients tell me that they've passed out on them, that they fainted on them, or that they can only stand to be upside down for like a minute or 2 minutes at a time. And if that's the case, you're really not getting that much benefit of it. So it isn't that the inversion table isn't effective. It's that people lack the ability to hang upside down, and that's very understandable, because I don't think that I could hang upside down for 15, 20 minutes, the amount of time it really takes for you to really get a decent benefit from the inversion table. And also, too, there's a reason why, even though they are decently effective, there's a reason why you don't see them in a professional setting, too, because in professional offices, we have better machines, we have better units that are able to help people, where you don't have to hang upside down, where they're more effective at decompressing the spine, decompressing, taking pressure off of the disc, taking pressure off of the nerve. So with all that being said, are spinal inversion tables worth the money? Should you get one? I would say for most people, they're not going to be that effective, especially when you look at the age group that's using them. The people that are able to maybe tolerate, in general, hanging upside down are going to be younger people. Kids, teenagers. Kids love to be, you grab them by the feet, you hang them upside down, they think it's awesome. You grab your grandma by the feet, you hang her upside down, she's not going to think it's very awesome. But the younger crowd, kids, teenagers, even people in the young 20s, generally those are not the people who are suffering from back issues that would benefit from spinal traction, spinal decompression. So generally they're not the ones on it. The people that are contemplating using spinal inversion tables are generally people that are 40, 50, 60, 70, and generally I would say the older you get, the less tolerant you're going to be of hanging upside down. So if you are having some spine issues and you're looking for some way to do spinal traction or spinal decompression at home, before you go out and you buy an inversion table, I would say you find a friend that has one that you can try, or at minimum buy one that has like a return policy on it, because you might get it and use it once and it might give you the worst headache ever after you've hung upside down on it for a couple minutes and you decide to never use it again. So one, if you're dead set on getting an inversion table for home use, try one out beforehand. Make sure it works well for you. But there are other products too, traction type devices that you can get that do an okay job alleviating some of the compression on the low back at home, that don't involve you hanging upside down. With just a simple internet search, you can find some different products, things where you like lay on your back and they have like an elastic strap that straps around your waist and helps to pull you, to decompress, to take some pressure off. I've known some people that have had that and have had some okay success with that. I also found it's called a seated traction, which actually looked pretty cool. It was a harness that goes around your chest and it kind of fits over your doorway, and you kind of sit and the weight goes on the harness that is around your chest, while the bottom half, the weight of your hips, your thighs, your legs, then traction out the spine. And that would be something too that seems to me just as effective as an inversion table without hanging upside down. So I would say for most people, don't go out and just buy an inversion table before you try one. Although the idea of spinal traction, spinal decompression can be very beneficial for people, especially people who have bulging disc, herniated disc, people with chronic sciatica, degenerative disc disease, spondylosis. There can be all sorts of conditions that spinal traction can help. Hopefully this gave you some good insight into whether or not you should get a spinal inversion table, based off the experience that I've had over years treating hundreds and hundreds of patients, hearing hundreds and hundreds of testimonies of people who have bought inversion table, who have used one. But I will say too, definitely over the years, I will run across someone every once in a while who has one, uses it on a regular basis, and loves it. But in my experience, that seems to be pretty few and far between. So hopefully this gave you some good information. If you have any questions, please let me know. Have a great day.